Welcome to Fellowship Safaris, conversations about people of color and their journeys to subspecialist training in their countries of origin and around the world. Welcome to Fellowship Safaris. My name is Jerry Kariajahe, and today I have the honor and privilege to be able to interview one of my longtime friends who has a very interesting journey that I think would be wonderful to hear about today. However, I won't jump the gun, and I'll let her first introduce herself.
Okay. Thank you, Jerry, so much for having me. My name is Winnie Njuguna. I'm an advanced practice nurse or a nurse practitioner. Both terms are used interchangeably. And my subspecialty is pediatric hematology and oncology.
That's so great to hear, and congratulations. My question is that who is a nurse practitioner in the way you understand from nursing care and nurse practitioning? So who's a nurse practitioner?
Okay, so the concept of a nurse practitioner still poorly understood in our setting in Africa and even across the world. It took a while for the term to be accepted or understood properly. But the International Council of Nurses defines a nurse practitioner as a registered nurse who has acquired expert knowledge base, has complex decision-making skills, has competent clinical skills. And this is a nurse who functions with complete autonomy and is also credentialed and licensed to practice in their country. So basically, a nurse practitioner wears both a nursing hat and a clinical hat, and all these collectively be able to take care of a patient with complex diseases or complex pathologies.
That is such an interesting concept. And I like the fact that you said that it is a new concept in Africa. So, it being so new, and especially in our context, in the African context, what made you think about going into nurse practitioning? What was your motivation?
To be very honest, Jerry, I went to my master's training without fully understanding that I was going to do a nurse practitioner training. So it was one of these, what you call serendipitous occurrence. So I got a chance to do a master's training. All I knew was it was a children's nursing master's. So at this time, I didn't quite understand the details until I got into the program. Now, after gaining a full understanding on who nurse practitioners are, then the question of subspecialization came up. I remember the first few weeks into our training, our professors used to really explain the concept to us because it was still not clear, even to us who had started the training. So if I can unpack this a little bit more for you, Jerry, nursing has two major career pathways. So you can either advance in the pathway of a professional master's. That is where you get to do your master's, your PhD, and so on. So majority of nurses will leave the clinical practice because they want to become nurse managers, nurse educators, and maybe other managerial positions at the Nursing Council, Ministry of Health, and so forth. However, a clinical master's, on the other hand, will train a highly skilled nurse who remains with the patient in the clinical setting. So this nurse, as I mentioned, has very good knowledge base, is highly competent, can investigate, diagnose, and will do both the clinical and nursing management of patients with complex diseases. And they're also trained to perform advanced procedures. For example, if it's an advanced practice midwife, they can perform a cesarean section. An advanced practice nurse in hematology and oncology can perform lumbar punctures, administer intrathecal chemotherapy, bone marrow aspirates, and so on. So for me, I went in knowing I'm going to do a master's in children's nursing, but I was pleasantly surprised to see that this master's had a twist. And being a person who always loved to be with the patients and to remain in the clinical space, for me, I jumped right in and I was very excited.
I'm so glad that you unpacked it because, to be honest, I've worked in a setting with nurse practitioners. However, I never quite went in to really ask and interrogate, okay, So what exactly can you do and what's the breadth of
Mhm.
what you can practice? And so I appreciate you
Mhm.
unpacking that. I love how you're like, it was so serendipitous. You went for one thing, but you
Yes.
actually went in and discovered so much more. So I'll take a couple of steps back and ask you, how did you hear about this training and where did you go to get this training?
Okay, so I did my training in South Africa, in the beautiful city of Cape Town. And the university where I trained has a children's nursing department, and they had a very good working relationship with the hospital that I was working for at the time. So they reached out to the hospital to recommend a few nurses to apply for the program. I remember about 5 of us applied, and we went through an interview process. We had some sort of assignments to do before, and I was the only one who got in. I was very lucky, and that was in 2017. So, yeah, I got in because literally I was told there's an opportunity. Are you interested? Would you like to apply? I was very lucky.
That is so awesome to hear. And one of the big questions, it keeps coming up every single time, and we can never avoid it. When we think
Mhm.
about funding, what is the funding
Mhm.
structure for this program that you've been encouraged to apply for?
So, yes, that's one of the things I interrogated right from the word go. And I discovered that there's an organization that supports and funds pediatric fellows in Africa to pursue specialized courses. So, initially, or in the past, this organization only funded doctors. So I was among the first nurses to be funded for a master's course. Again, I was very lucky. So during the interview process and the processing of papers in 2017, I also got to apply to this organization, and the two are going in hand. So that's how I got my funding. So this funding involved tuition and any other expenses that the university had in place. And in addition to that, there was a stipend for us to get by, which had accommodation, food, and other expenses. Again, the hospital that I worked for also gave me a certain percentage of my salary for the entire period I was away in training, and also guaranteed my job back upon completion, which was pretty amazing.
Hey, Winnie, this is a paved, I don't even know if the word is paved, anointed. I think it's one of those combination of resources
Mhm.
that I think were just perfect in the sense that
Yeah.
you didn't have to think about finances. You are able to
Mhm.
focus on your academics and like your training and upping your
Mhm.
skills. So it's really exciting to hear that there are
Yeah.
actually opportunities like that in
Mhm.
Africa that people can be able
Mhm.
to apply and get. So there's something in the beginning when you were introducing yourself, you mentioned that you subspecialized in hematology and oncology. So you've told us
Mhm.
how you landed in the nurse practitioning piece. So
Mhm.
why hematology oncology specifically as your area of subspecialty?
Okay. So back at home in the hospital that I used to work in, I was a trauma and emergency nurse. And that was the place I enjoyed the most. Oh, I enjoyed my time in the emergency room. I enjoyed being in acute care. The emergency room was really my happy place. I even trained nurses and doctors on emergency courses and also facilitated several emergency drills. So naturally, you'd think going to the master's course, I would specialize in trauma and emergency, right? Wrong. And I'll get to that in a minute. So while at the ER, I used to see patients with cancer coming for review, chemotherapy, etc. At the time, we did not have a dedicated oncology unit at my hospital. So I remember isolating these patients in a room. We didn't have very many rooms, but I would try and keep them away from the other children in the lobby who had coughs and colds. And I kept thinking about this, and I thought there really should be a place where these children can be seen or managed better. And then over time, I will hear that this child that you've been taking care of passed away. So over 80% of these children will die. And this was a very sad event for me, but it always sparked an interest, and I kept wondering, what are we doing wrong? So I get to South Africa, get into this amazing hospital, and I learned that nearly 80% of these children with cancer survive. And that was mind-blowing for me. I wanted to learn, what is this that we do differently than what we do back at home? The last 3 months of first year of training, we were to go back home and get attached to a pediatrician to sort of see how you will fit as an advanced practice nurse or a nurse practitioner back at home. So I get to my hospital, and the chief of clinical services attaches me to a pediatrician who has just completed her fellowship in hematology and oncology. So we'll go around, see patients in the wards with pneumonias and all other illnesses. And then at the end of it all, we'll go to the clinic and see patients with cancer or hematological diseases. And it was during this time that even her, she had seen the need to have a dedicated unit for patients with cancer. So I would say during my 3 months attachment back at home, that was the piece that I enjoyed most. So we set up our oncology outpatient unit. I enjoyed my time with patients with hematology and oncological diseases. And by the time I got back to my second year, I was sold. I remember my professor kept making jokes. Winnie came in as an emergency and trauma nurse. Now she will graduate as an advanced practice nurse in hematology and oncology. So, yeah.
That's so interesting to hear because, in terms of emergency care, for many years, I remember we worked together. For me to see you transition into hemato-oncology, it
Mm-hmm.
was a pleasant surprise.
Mm-hmm.
And what I'm also hearing you saying is that you are actually open to the experience. You know, when you were told be attached to a pediatrician and you are
Mm-hmm.
open to the experience, that may not have been what you were gunning for, but it actually ended up opening up this whole new door and pathway for you. I'll shift a little bit and just
Mm-hmm.
ask about the actual training. So now you're in South Africa. What was the nurse practitioner training experience like itself? How was that for you?
Okay, so the nurse practitioner learning experience was a very, very rich experience. I was lucky to train in one of the top universities in Africa and one of the biggest children's hospitals in South Africa, with very highly skilled and dedicated professionals. So the learning experience in itself was very experiential, very hands-on. We spent over 80% of our time with the patients. And this is unlike many of the professional master's programs that I spoke about. Our classes were combined with pediatric fellows and those taking subspecialty programs. And in the clinical setting, we reported to the consultant in the unit, and we would get assigned patients just like the fellows. So we would have our own caseload, we would examine the patients, we would come up with a diagnosis, we order tests, we would perform advanced procedures, prescribe medication, etc. Then present all these to the consultant during the main rounding, just like the fellows did. And this was a huge learning curve for me. And then the department also included other innovative learning opportunities, like we were required to develop a portfolio of evidence. We were supposed to do reflective learning. And this I found new and very, very useful because it makes a student really reflect upon your learning experiences. It allows you to step back and sort of learn and develop your critical thinking skills. You analyze your experiences. What happened? How did it happen? How can I change my future practice? So this eventually will lead to improving on your future performance. So to date, this still forms a very essential component of my toolbox for resources, and I keep referencing these to do my job. So it was such a rich learning experience that I am very, very happy to have had a chance to go through.
Oh, wow. There's so many things to unpack there, and you'll allow me just to take a little bit of time. So,
Mm-hmm.
you're talking about almost like learning a whole new way of doing medicine because now there was a lot more to do. There was procedures that you had to learn. There was having a caseload and diagnosis and prescription, which is not what you were previously doing. So as an adult learner, how was that for you? Because this is a new set of skills that you're having to acquire and quite fast. So how was that? I know you said steep learning curve, but how was it actually just trying to adjust to that, and what helped you adjust to this new, skill requirement and skill acquisition?
Okay, so I would say right from the beginning, every professor will tell you that this is not the traditional masters. This is a clinical masters. You're going to be clinical, hands-on nurse practitioners. So that was sort of hammered in, and it required a lot of mindset shift. And then also learning that over 80% of our time would be spent in the clinical space. Again, that was also a mindset shift, because we thought going to go to a classroom and learn so many other things, but there was a lot of clinical learning and clinical practice. And then getting a chance to work with fellows and people who've done this like every day of their lives and their careers, again, was very, very useful, because we would interact with them, we would consult where things were not clear. And then the consultants in the units were very, very helpful, because once you go to presenting your patient, it was a very interactive sort of learning experience. So if, for example, you missed a test to order, we'll all brainstorm in the session. What else? What other tests did you need to do? And it will prompt your critical thinking and your decision-making skills. And step by step, I just took it all in and got into that space, and I loved it. But it wasn't easy, Jerry. It wasn't easy.
I hear you. It sounds like it was just that mind shift and that, changing it to a growth mindset. And I can hear it
Yeah.
in your willingness to just learn these new things. And at the same time, I like the fact that your teachers acknowledge that even as you're coming into this space, there was that
Yeah.
constant need to just keep, verbally telling you, this is what we're doing, this is what is expected. Like it was constantly drummed in during the course of your training. And when you think about your training experience, what were one or two highs? What were one or two things that were very exciting and what you'd consider the highs of your training?
There was a whole new learning experience for me. That's number one. I thought I'm going into a sort of a traditional classroom teaching and a few clinical rotations, but the learning experience in itself was different, and that for me was very exciting. I was in a new country, experiencing new cultures. You would think that it was in Africa, but South Africa is totally different from the parts of Africa that I come from. It's a whole new world, so to speak. So I got a chance to meet other colleagues. I was only Kenyan in my class, so I got to interact with people from all over Africa, from West Africa, and from some South African countries, and even some exchange students from other parts of the world. So learning in the same class with these highly trained professionals, doctors, pediatricians, having a seat at the table and having my voice heard was, I think, one of the highlights of my training.
I love that part about being with people from all over and also having your voice heard. I think that's amazing, especially in the
Yeah.
clinical space. And during the course of the training, with the training
Mm.
experience, can you think about some lows?
Um, yeah, so being in South Africa, we've heard about xenophobic attacks, and that for me brought some bit of anxiety. And it also influenced some certain decisions, such as where I lived, even modes of transportation. You see, South Africa is a rainbow nation with people of different ethnicities and races. And most native Black Africans choose to preserve their culture and heritage by still speaking their native language and not, you know, English language. So in a taxi, which is a public transport, they will address you in isiXhosa, which was the language that was spoken by most Black Africans in Capetown. And failing to speak the language would mean either you're too proud to preserve their heritage or you're a foreigner. And both instances made one stand out. And I didn't like that. There was also a high rate of crime in that part of the town, unfortunately, and violent crime. I remember I had a horrible incident where we got robbed in a taxi of our valuables. And again, that was a very low moment. I was this close to giving up and packing my bags and coming back home. So I had to make some decisions where I lived close to the hospital, where I didn't need to use, public transportation many times. And if I needed to get by, sometimes using commercial taxis like Ubers, which was quite expensive. So yeah, that was one of the difficult moments that I personally had to deal with during that time.
Oh, wow. I'm so sorry. That
Mm.
sounds like, on the one hand, you're having this amazing learning experience, and unfortunately, the
Yeah,
reality of the environment having an
yeah,
impact on
yeah.
your ability to learn and feel safe. And I'm so sorry to hear that. Just to shift a little bit, were there opportunities for you to be able to plug in to research, and were there, and if so, were there particular areas that were of interest, or you managed to do a little bit of research in?
Yes, so the nurse practitioner program really has three main elements. So it has the advanced clinical skills that we have to learn. And then there's also an element of clinical leadership and clinical research. So research was one of the core courses that we had to take. So I learned how to critically appraise evidence. And that's an angle that I had not really learned before. So we would critically appraise evidence and also learning the process of development of evidence-based practice guidelines from systematic review of literature. So we had to come up with evidence-based practice guidelines for your subspecialty. So I remember I did something in regards to nursing care and central venous access and things like that. So that was very, very important for me because back at home, I was able to really look at what we had, what were the nursing tools, the nursing policies, and really improve on that. And also various quality improvement initiatives, which again was very, very useful going back home because we didn't have very many patients back at home with hematological and oncological conditions. So I doubled as working in the unit and also working in quality and patient safety. So research was very, very important and it came in handy once I started practicing.
That's really helpful to hear. Just being able to recognize that it wasn't just the master's training, but then
Yeah.
sort of like a sustainable model, when you're
Mm-hmm.
going back into the hospital that had sent you, that there's
Yeah.
also, like, from a structural perspective and from like a policy perspective, they've also given you
Yeah.
training, which I think is really amazing. And what would you say was a belief or a habit that you picked up during your master's training that helped elevate, who you are as a person and who you are as a professional?
I think one of the things that I picked up was the skill of actively listening and understanding. And I choose to talk about this because it was particularly useful when dealing with families with chronic diseases such as cancer. There's some aspects that we often ignore, some family dynamics that you can only pick if you listen actively and get to understand. So these dynamics will impact on the care for children with these complex diseases. So listening, understanding these various dynamics will help us to tailor these individual families' needs, priorities, and also to help them navigate these life-changing events. Because, Jerry, families break, jobs are lost, families go bankrupt due to a cancer diagnosis. So it's important to understand all these and help these families through the entire disease continuum. I realized in acute care, everything was moving very, very, very fast. And I never really got to sit and listen and take time and listen and understand. So this for me was something I picked up and I found it very useful.
That's really, giving that context of you had worked in the acute setting for so long and now actually just getting this skill where you have to literally stop, listen, understand
Yeah.
what's going on is so helpful
Mhm.
to hear about that shift. Hematology and oncology is what I call passion work or heart work. And at the
Mhm.
same time, I'm very mindful that the kinds of things that you see, the cases that you sort out can
Mhm.
have a mental toll and,
Yeah.
be very heavy.
Yeah.
What are some of the things that you did that helped with the mental health, with your mental health aspect and helped with your well-being?
Mhm. I have to say, a lot was happening for me. So there was this shift in my career and also being in a new country, being in a new program. So really, we had what we call debriefing sessions every 2 weeks. So one of the clinical nurse specialists had organized this session where we'll have a debriefing session, and we'll all go sit, relax, and basically just talk about our experiences and everything else that is going on. And that was very useful for me to sort of take the load off and to speak about everything else that was happening around me. On top of that, I also used to live within the hospital. And just next to it was a very big field where I picked up a habit of running around the field. So many people jog or run. And for me, doing that every morning was very useful because that's release of endorphins from exercise helped generally improve my general well-being and even mental well-being.
What was your preparation for your family
Mm-hmm.
as you were transitioning, you're moving countries, you're starting this new program? What was your
Mm-hmm.
preparation for your family? What did that look like?
So around this time, I remember that year my son was 7 years old and he was just starting first grade. And my now ex-husband and I had moved to a new part of town and to a more permanent residence. So one of the main problems I had at this time was that my old nanny decided to quit on me just a few months to me starting the program. So we were really stressing about finding a living nanny for my son, and that was stressful. Eventually, we did find a nanny just weeks to my departure, and I barely knew her well enough by the time I left. So I was pretty anxious about leaving a new person, a living nanny who I hardly knew. However, she turned out to be such an amazing girl and a blessing in our lives. And she's been in our family since that time. So that preparation, getting somebody to take care of my son, having moved to a new residence, it was quite big sort of change for my family, but we managed to get through that.
Mother to mother, that sounds so stressful. I'm so glad that you were able to get help to take care of your son while you went away to study. What was your transition back
Mm-hmm.
to Kenya? Coming from a place where you've been trained and, there's this master's training, very clinical, and you're coming
Right,
back to a country where it's a new concept. What was
right.
that like?
So coming back home was exciting and interesting. Kenya to date has not credentialed or established a scope of practice for nurse practitioners. But the hospital I was working for, I had made them understand during the first year that I went back, the 3 months. So slowly I made them really understand what my training was all about. So by the time I got back, we sat with the head of clinical services and the head of nursing services and designed a job description similar to that of a nurse practitioner. So the hospital gave me additional privileges to be able to do some of the procedures or some of the things that a nurse practitioner can do. So I worked closely with a pediatric oncologist, and we saw patients and families with cancer. I was able to perform advanced procedures. I was able to order tests, prescribe chemotherapy, but I couldn't quite function with the autonomy that nurse practitioners really practice with, because I was uneasy that we were not yet licensed by our council to practice. But I would say the experience for me was very rewarding, because even during that time, even practicing with the added privileges that the hospital gave me, I still felt I did quite a lot and were able to improve the overall care and the journey of patients coming in with cancer and improve on delays. And it was an amazing experience. But that one piece of not being registered or licensed for me always stood out, and it was a challenge, to be honest.
Oh, wow. So,
Mhm.
are you one of the first nurse practitioners who came back to Kenya? Would you know if you were one of the first or in the pioneer set of nurses who've now transitioned into nurse practitioning?
The university that I trained in, at the time, it was the only university in Sub-Saharan Africa that offered the course. And prior to my class was the third cohort. So the second cohort had two Kenyans in it. So two Kenyans had actually graduated and come back to Kenya. So as far as I knew, by that time, we were only three of us who were alumni of the university in which I trained in. So I'd say we were pretty much the first pioneer groups, or rather pioneer team of nurse practitioners in Kenya.
That's amazing. And it's interesting to hear about how innovative you were in terms of, and the institution that you worked at, you were innovative
Yeah,
in terms of there was a certain skill set and
yeah,
figuring out spaces where you could use the skill set that within the purview of your licensing, however,
yeah.
just working it out so that you're going to maximize your skill set.
But
And
allow me to mention something
yeah,
else, Jerry. I think it would not be fair not to mention this. There being no scope of practice or no license for nurse practitioners in the country. So I mentioned at the time in 2017, 2018, by that time when I was doing my training, the university in South Africa was the only one training. But around 2020, there's a university in Kenya that started training nurse practitioners. So I remember now this university was advocating for a scope of practice or licensure for nurse practitioners, because they wanted the ones who graduate from their university would get licensed to practice. So I remember they lobbied, tried to find were there any existing nurse practitioners, and they got to hear about me and the other two nurse practitioners alumni from the university I trained in. So by the time I left Kenya, because I'm no longer practicing in Kenya, unfortunately, we had several stakeholder meetings with the Nursing Council of Kenya and several universities in Kenya, trying to come up with a scope of practice document that would eventually see nurse practitioners licensed. So there is hope in the next few years, nurse practitioners will be licensed in our country. So that's pretty amazing.
again, the thing that amazes me about your learning trajectory is that it didn't just end with you being able to come back and get a job, but then
Mm-hmm.
it also involves you being able to advocate for other people to get opportunities and for licensing to happen,
Yeah.
which I
Yeah.
think is amazing. Now that you mentioned that you're no longer in Kenya, in terms of the opportunities for you on a global scale, what did that do
Mm-hmm.
for you? I know you've said that there was a bit of limitation with
Mm-hmm.
licensing in Kenya, but from a
Mm-hmm.
global perspective, what did that do for you and for your career?
So after about 3 years of practicing in Kenya, I felt like I was not exploring my full potential. So I started looking around for other prospects. So I was lucky to find an opportunity with a hospital in the United States. So here I got a chance to work in the global pediatric department, which is part of the hospital that works with organizations such as World Health Organization and with an aim of improving outcomes for children with cancer in low and middle income countries. So I get to be a global nurse program coordinator working on pediatric hematology oncology nursing programs such as education, capacity building, research in low and middle income countries. So I am not in direct patient care as of now, but I believe the impact is also greater at a global scale because we're able to, have these initiatives that improve the nurses' knowledge, capacity building, improve on their research, develop policies and procedures, all aimed at improving outcomes for several children across the world with cancer. One of the hospital's main objective is no child should die of cancer, regardless of which part of the world they come from. So I think that's what motivated me to make the shift and also remain relevant into this pathway, this career pathway that I chose of pediatric hematology and oncology.
What I love is at the heart of things, you're still a teacher
Mm.
and a policymaker at heart. I
Yeah.
think
Yeah.
it's really exciting to hear that that's the kind of work that you're doing and your skills are
Mhm.
being used to impact people at a
Mm.
global scale. And I absolutely love what you've said about no child should have to die from
Mhm.
cancer, no matter where they are, no matter where they
Yeah.
come from in the world. That's
Mm.
amazing to hear.
Yeah.
And my question would then be from there, what would be your piece of advice for anyone who's thinking about going into nursing, or if someone who is in nursing and thinking
Mhm.
of training as a nurse practitioner? What would your words of advice be for this person?
So what I would tell this person is there are different pathways in nursing education. I remember I mentioned earlier there's the professional masters and there's the clinical masters. So nurse practitioners contribute greatly to improving outcomes for children with complex diseases. And their learning opportunities in the university I trained in South Africa, plus even now closer home, one of the top learning institutions started a program for advanced practice nurses and advanced practice midwives in 2020. And I think the first cohort of family nurse practitioners have either graduated or about to graduate. So there is opportunities for nurse practitioner training even closer home. So those nurses who want to remain highly skilled, highly competent in the clinical space, there are opportunities for you, even in our country.
I really love that. Thank you so much for sharing that. And what would your advice be for
Mhm.
a nurse practitioner in training?
I have to admit, I put in a lot of work. It was not easy, to be honest. So you have to really put your best foot forward and work hard and really give it your all. One of my motivations, particularly studying from another country, was I can't leave my family and spend 2 years in another country and not ace these things. So that was my motivation, really. What brought me to these countries to study and work hard, and it pays off eventually. It does pay off. And then again, what I would tell those in training already, as I mentioned, Nursing Council of Kenya is in the process of licensing nurse practitioners. So hopefully by the time you graduate, you will be credentialed and licensed to practice in Kenya. So work hard. There's a lot of potential for you.
And I absolutely, again, this is so inspirational to just hear
Mhm.
that there are opportunities awaiting these trainees once they come back
Yeah,
home, just given all the work that's being done. So,
absolutely.
are there any, like, just last words, that you'd want to share with our listeners about anything that's on your heart about nurse practitioning and their role, in our healthcare professional structure.
I think my parting shot is I feel very honored to be on your platform, Jerry, to be able to speak, hopefully, to a couple of people and sort of demystify who nurse practitioners are and their contribution to healthcare, particularly in children, or rather in populations with complex diseases. There's been lots of misconceptions and myths surrounding nurse practitioners, role confusion, people thinking that nurse practitioners are taking their jobs, but really it's a step into bridging the gap where we have few skilled healthcare professionals and bringing in this all-rounded individual who brings in a wealth of nursing knowledge and now clinical assessments and wholesomely being able to take care of these patients with complex diseases. So I'm happy that you gave me this platform, and hopefully I have communicated to a few people and they can see the role or the contribution of a nurse practitioner in healthcare.
Thank you so much, Winnie, for taking the time to be able to talk to us about nurse practitioning and specifically your subspecialty in hematology oncology. And I'm so excited about your impact at a global scale and that people could be able to hear that. Because I know from some of the people that I've had conversations with, they're really trying to figure out, what do I do next? How can I elevate my experience as a professional and at the same time also have an impact to improve healthcare, to improve my world? So it was really insightful to be able to hear about your experience. And thank you so much for giving us this time and sharing this time with us to share your experience.
Thank you, Jerry, for having me. It's been an absolute pleasure.
I'm so glad you stayed tuned. Please get the word out and share it with at least 3 people. Make this episode like a chain letter. Share it, share it, share it. Come back for the next leg of our safari where we'll be talking about...
The stars were shining on me. I had no much difficulty. There was no much change in location. I was getting funding. I had my siblings, my sisters. One of them came to live in with me, especially helping to take care of the small baby when I had to travel.
Listeners are advised to use their own judgment and discretion when applying any information discussed in this and all podcast episodes to their specific situation. Always seek the advice of a qualified professional if you have any concerns or questions regarding a particular subject matter. You can find this and other episodes of this podcast on our website at www.fellowshipsafaris.org. You can also find all our episodes on all podcast platforms. Reach out to us on social media as Fellowship Safaris on Facebook, Instagram, and TikTok, and our Twitter handle is @fellowshipsafar. You could also send us an email on fellowshipsafaris@gmail.com. We look forward to hearing from you and interacting with what you have to say about the Fellowship Safaris podcast. It takes a village to make this podcast. The executive producer and original music is done by Mokavi Maweu. The sound engineer is Tevin Sudi with thanks to AQ Studios. Graphic design was done by Benjamin Mboya. We would like to give a special shout out to Josephine Karianjahe and Melissa Mbogwa of Africa Podfest. All rights reserved by Dr. Jerry Karianjahe and the Fellowship Safaris podcast.